Good afternoon, everyone. My name is Crystal, and I wanted to talk about my experience interviewing the informatics nurse at my current organization. A little background on myself. I've been with Emanate Health in our community hospital in the emergency room for about 7 years, and I started there as a new grad nurse. Really, to be honest, I never thought about informatics or the technology we use at work until we started this course. I had the opportunity to interview the senior nurse, a clinical informatics specialist at my work. Her name is Margarita Legaspi. Truly just an interesting story on her and how she got into her position. She started with Emanate, which used to be known as Citrus Valley, about, a long time, 1994. She started there as a new grad nurse, and she worked her way through the departments, several different units. Med-surg is where she started, DOU, critical care. And while she was doing her bedside nursing, she always noticed things that could have been better, things that could improve patient outcomes, safety issues, gaps in care. She was always championing for better. And she put in her time there as a bedside nurse, and her background education was she has her ADN and bachelor's in psychology. Well, they noticed her passion for safety, and they offered her on-the-job training in informatics. So she took it. And she's been in that position for about 10 years now. And it's just fascinating things that we just don't think about when we're at work doing what we're at work to do. What surprised me from this interview mainly is just how crucial it is to use informatics to improve patient outcomes. Legaspi explained to me that informatics is the bridge between bedside nursing and communication, and it all together makes documentation vital for what we do. It's proof of the care we provided. It proves what we did, what we didn't do. It's basically the history of what happened while this patient was underneath our care. Moreover, when we notice things, changes to our electronic health record, it's always due to something that has occurred. So either fallout, gap in care, policy issues, anything that needs to be addressed now is addressed in our electronic health record. Some other things that I kind of do like about informatics and just kind of open my eyes a little bit more is the different tools they use to alert us. So some of my favorite tools is the pop-up alert. And I know a lot of you probably witnessed these at your own work. The big one at ours that kind of got implemented, I think about 4 years ago, was a sepsis triage protocol. So when you're triaging, I'm in an emergency room, as a triage nurse, you're documenting vitals, talking to the patient. When the system gets alerted that there's certain criteria getting met that qualifies for sepsis, it's going to prompt you, the nurse, hey, this patient is sepsis material, risk for severe sepsis, and it lets you know you need to notify the provider that this patient is a sepsis risk. So what we're doing is, as soon as that patient sits down, we are getting alerted to treat this patient right away. So as soon as this patient gets roomed, the doctor's probably already put in their sepsis protocol bundle, and we're, going to hopefully have a good outcome, and, the patient benefits. We all benefit from it. The question I wanted to look into, and I personally asked her, that I came up with myself was, what is the process as a bedside nurse to implement change? So how do I implement change within my organization through informatics? and she kind of broke it down for me with how it works. If you see a problem, voice it. So how do you do that? Send off an email. So what you do is you email the service desk. The service desk then determines, is this a clinical software issue? Is this an IT issue? Once you figure that out, if it's clinical, it then gets the email gets sent to your informatics nurse. Then whatever informatics nurse is assigned to that department, so Miss Legaspi is emergency room, so she would take over this email, and then she would determine, okay, is this something I can change on my own? Does it have to meet certain policies, hospital policy, joint commission policies? And then do I need to have management involved? Do I need the director involved, the CNE, stuff like that? So that's how that works. And then they figure out how to implement it. They work with IT, and then there you go. You've made a change to your EHR, hopefully for the better and to better help your patients. Understanding that process builds leadership. As graduate nurses, understanding the informatics role is just a little piece of understanding the entire organization you work for. So collaborating with different practices, different what's the word I'm looking for? Clinical specialists just enhances the overall goal, which is good patient care. Also, understanding the inner workings of the informatics nurse at my work helped develop changes within my organization and for patient outcomes. And I'll give you an example. During flu season this year, or COVID season, whatever you want to call it, we had ordered a lot of respiratory panels. Now, for most of these pediatric patients that come to ER, we swab in DC. They're in and out, less than 10 minutes, gone. What we started noticing was we're swabbing the patient for the respiratory panel, sending it, but then the next day there's no result. So basically lab saying, we didn't get it, we don't have it. So that made me think, what's going on to cause this problem? So I called lab. Laboratory told me that if we swab a patient and discharge them out before they physically receive the swab and run it, the order's gone. They can't run anything without an order. So this is how you get your informatics nurse involved. You let them know the problem, and then we come up with a solution. So essentially what we needed to do was have a task come onto the EHR. So when the doctor ordered the respiratory panel, the task pops up on the EHR. The nurse swabs the patient, collects the swab on the work list, and then that notifies the lab, hey, there's a swab that needs to be ran, there's an order in, you can discharge the patient, less than 10 minutes, but you know that swab's going to get ran, and it's documented that you collected the swab. So these are essential tasks in prompting the nurse, and we're closing the gap in fallouts. I enjoyed this interview. I thought it was great. It kind of opened my eyes up to how important everyone's role is within an organization. I hope you enjoyed your interviews, and for myself, I understand the importance of collaboration, utilizing departments, and my role as a graduate prepared nurse. Thank you.